Hello everybody, very good afternoon. I'm Dr. Ketan Patel. I'm heading emergency medicine department at Zydus Hospital in Ahmedabad in Gujarat. We are doing this program for this betterment of the society health and the common people who are not medicals, who can help their near and dear one or this other people in the society when they come across any emergencies. So today we are going to talk on some of the important medical emergencies. So what you can do best, and some of the important tips what you should not do at any given time, because certain times it's rather than helping it causes further problems, and the person become more complicated or become more sick. So first we'll talk about unconsciousness. Any person who initially having a problem suddenly in front of you become unconscious. So we always ask everybody to just before do anything, make sure that you confirm whether it is unconscious completely or is it semi-conscious or it just fall. That's all. So when somebody become unconscious, your first job is to confirmations. You tap on both the shoulder and confirm whether he is unconscious or conscious. Once he is unconscious, so first and foremost you need to check the most deadly conditions for us as a medical practitioner, as well as for the layman people. You need to understand the cardiac arrest, when the heart stop beating. So how do you recognize that somebody's heart is not beating? So that another part to identify is for non-doctor people need to look at for this: the patient is moving despite of your movement or anything, or is breathing. It means his chest is going up and down or not. If any of this one is not happening, it means the person having a cardiac arrest. If there is a doctor or the healthcare provider who works in a hospital who knows how to check a pulse, so they check the pulse in this in the neck. That's called the carotid artery pulsations. If he's not there, think about that person, his heart is not beating and need extra support in the form that artificial pumping of the chest. That's called a chest compressions. Now, the first and foremost, before you start, you always make sure that you call an ambulance services. So whichever the region you are, whichever the country you are, you need to call this ambulance services immediately and tell them about exact locations and the type of emergencies that patient who is in cardiac arrest. After that, you need to start artificial chest compressions, chest pumping in the center of the chest, in the nipple line. That's called breastbone, which is where this heart is lying underneath that. And once you start compressions, you should compress, push hard and push fast in the sense that it should be at least about 2 inches in adult patients to be compressed the chest. Rate is little fast, about 100 to 120 per minute. So you can pump adequate amount of blood to be pumped out, oxygenated, which can circulate the most important 2 vital organs. One is for the brain and one is for the heart. So that is the whole idea, to start an artificial chest compressions till the time your ambulance crew member, paramedic or anybody come and take the charge. Now, if we talk about this certain centers or the Western countries, one of the important machine available, that's called AED, automated external defibrillator, which is available at certain public places. Even in India, it is available at the major airports like in Mumbai, Delhi, Hyderabad, Chennai, somewhere. So you can apply this one on a wrist, right, which is the diagram, everything. And if this AED machine, this is completely automated, it advises you to give a shock. You can advise, or they'll advise you to continue the chest compression. So you can probably save a life. Now, in this component, we talk about an unconsciousness, where person is not having breathing or become unconscious and no pulse. The other side, the person become unconscious or become semi-conscious, but his breathing is there. Or might be when you shake and shout, he'll respond little that, okay, something response comes in that. It means the person is not completely unconscious or not completely losing his normal breathing or a heartbeat, that time you need to probably turn the person on one of the side, either the left side or the right side. Now, the biggest advantage to do this one, that he's basically his oxygen pipe, which is there lying, keep it open. So the oxygenation and carbon dioxide, which is oxygen goes in, carbon dioxide comes out, pathway remain clear. And the second thing is you can prevent obstructions. And the third is when somebody vomit, right? If is a person who is unconscious or semi-conscious vomit, so if he's lying down flat, so some of the content goes in the airway pipe, and that causes choking, which can again become sometimes deadly for that. When the person is lying on one of the side, it comes out from the side, and you can prevent the aspirations and prevent further complications for the respiratory component. So this is a two important thing which we start always first within somebody who is unconscious or somebody who is semi-conscious. Now, in another component we talk about, the next emergency is somebody who is diabetic patient. Now, the person who is diabetic, if he become faint, or he start perspirating, or he start feeling uneasiness, lightheadedness, kind of symptoms, we always say from the medical side, think about they could have they might have this possibility of low sugar level, that's called hypoglycemia. Now perhaps the major concern for everybody, that the person who is diabetic and you are thinking about the low sugar, and we advise that when the person who is saying diabetic or having a low sugar, please give a sugar supplement from outside in the form of either you can give a chocolates, or you give a biscuit, something like that, to improve the sugar level. So probably in a general populations, this is another question, that already sugar patients, if you give sugar, it goes high. Why should you give it? But please, everybody need to understand one thing, that high sugar, it's not the problems. The low sugar, which is very dangerous. So if somebody's sugar goes to about 50 or a 40, for us it is very dangerous. Whereas if somebody has sugar about 300 or 400, it's not going to kill the person. So please understand, the low sugar is always problems. So if the sugar is dropping more about this one, the patient can have unconsciousness followed, they can have seizures, the fits, and person become unconscious and ultimately can die even in that. So any time you come across somebody diabetic patients or become faint or anything, we always suggest that you always try to give a sugar content, either you give anything in that. Now, this is in the context of unconsciousness or semi-consciousness. So the major tips is, please remember not to give anything. If anybody who is semi-conscious or unconscious, not to give anything through the oral cavity, through the mouth, in the form of liquid. Because when you give any liquid who is unconscious or semi-conscious, they are not in a complete conscious mindset that am I drinking or not. So they don't have another control. So whatever liquid you are giving, it goes in the windpipe. When it goes in the windpipe, right, the person has a choking and further compromise his breathing, and you are not basically saving the life, you probably make the life danger further, because you are not understanding this is not helping them. So anytime anybody who is semi-conscious, unconscious, please do not give in any liquid form. We can say at the same time, do not give anything orally in the form of solid form, because he is not able to swallow properly, and if he's stuck in the air pipe, again causes choking and further complications again. So now the question is, what you can do now, what you should do that to improve the sugar level. So we always suggest that if the person who is diabetic and not taking regular meals, or he skip the meal because of whatever the reasons, right? You always basically counsel or explain them that keep some chocolate biscuit. As soon as you start fainting, getting little giddiness or this the vertigo kind of things, you immediately take that one. If it's not possible, if it's not taken, then you can use a sugar powder which you can put in the mouth where it can absorb. So person do not need to swallow or just deglute over there further, because if the sugar powder which can swallow and the patient's sugar level increase and might he regain consciousness, it'll be fine in that. So please remember everybody, the person become unconscious or semi-conscious, do not give anything orally in the form of liquid most of the times, please. Now we are covering next topic is on seizures, that's called fits in the continuity, because there are many patients post fits, post seizures become unconscious. We follow the same formula, same steps in the form: check patient's conscious level by tapping both the shoulders. If he's still unconscious and not having breathing, or if you are working in a hospital or you know how to check the pulse in the neck, then you can, there's no pulse, you can call ambulance and start a chest compression, which I talked earlier. If it's not a case, then you can turn on the one side, because most of the time the person's post seizures, post fits, he's become unconscious, so put in a one side of positions. Now before this one, that patient has seizures, the patient can have seizures in 3 different positions. One, either the person is standing, person is sitting, or person is lying down. So there are incidents that person who is standing or sitting having fits, they'll fall or they hit to the other objects which is nearby. If I'll say I'm currently sitting over here, if I fits, probably I fall from the chair because I lose my conscious state level and I can injure myself. So same for somebody who is standing. Less likely somebody injured who is lying supine on a bed or something like that. So anytime somebody has a seizures or the fits in a positions while standing or sleeping, standing or in a sitting, make sure they'll lie down on a flat surface. The people used to do that, they try to put something in the mouth in the form of handkerchief or anything to prevent the tongue bite. Please, you should not do, because many occasions that can obstruct their air pipe, as well as it's not going to help, because it's not going to make the tongue to be injured more, which can be the grievous or which can be more dangerous in that. The other things which we suggest, that specifically the old age people and the children do not hold tightly their hands and the fits, because when somebody has an acute attack of fits or a seizures, they always try to having a jerky movements. So if you tightly hold, their bones are weaker, so probably they have fractures. So please do not do. Most of the occasions, the fits or the seizures subside by themselves. So after a certain period of time, about a minute or so or 2 minutes, they'll subside. So you don't need to keep holding for tightly, because that can cause the break their bones and cause a fracture over there. So basically your ultimate aim is to help somebody, where if you have a fracture, which is not the good thing which you are looking forward, that to help somebody in that. And once the fit's over, turn the patient on one side and shift to the nearest hospital where the doctors and the team can look after this one. So anytime you have come across this one, please take it in the steps of this one, considering while patient having a seizure or the fits. I don't know, in India we have seen many people to do this one. Please do not do this one. They try to smell somebody when fits, to smell the very dirty or the old shoes or the onion or the socks to make them conscious. You can't help them with this activity, because this is not the treatment part of this one. This can cause a further delay of the treatment and cause further complication in that. Now, next talk, which we talk about an acute stroke. Acute stroke has an understanding for the layman people, for the common public, is a paralysis attack. So first and foremost is how to identify and why it is important to identify the acute stroke patients. Now, identification of the acute stroke patient, that somebody sudden onset, about one side of the face because deviated to one side. If you ask to smile or if he's speaking, he'll deviated one side. His voice is changed, but he's not able to speak. If I'm speaking normally right now and suddenly become, oh, good. If you feel so that this is voice completely changed or is not able to speak, this is another sign. And one is that one-sided of the body, either right hand or right legs, become weak. So if I'm holding in a pen, it drops from my hands, or I'm holding in a cup of tea or this coffee, I can drop from my hands or become weak. It suggests the patient can have an acute stroke. There are other components there, the difficulty in seeing over there, the listening over there, understanding, become unconscious. These are the other, but the three major: deviation of the mouth, sudden change of the voice, and one side of the body become weaker, suggests the patient could have an acute stroke. Now, acute stroke, the paralysis attack, have two varieties. One is called an ischemic, where the blood, the vessel, the pipe, which is blocked by the clot. And other is called hemorrhagic, where it's burst, the blood vessel, the pipe, which is burst, and in the brain you can see the blood over there. Now, maximum time, the people having the blockage of the vessels, which can lead to these symptoms. Now, why we are talking, and precisely I want to give an information on what to do in this case, because this is major help. Because when it happens to this young age populations, an acute stroke, who is a major earning member in the family, or the major person to serve the society one, if he become paralyzed, right, and if you treat on time, he is paralyzed physically, he paralyzed financially, he paralyzed mentally, he paralyzed socially, because 24/7 he needs some assistance. He cannot go for any single routine activity anywhere without somebody's help. Where the other part, the major concern for us to tell all you people that you identify this person who is acute stroke, then you need to go to your hospital, which is able to treat this kind of patient. That's called a stroke center. Now, stroke center is such a center in this hospital. One of the important component that they have an emergency doctor who can identify that this patient acute stroke. The hospital is equipped with the CT scan, MRI. The hospital have a full-time or available neurologist or the neurosurgeon or the intervention neurologist who can open up the vessel, and the other support services in the form of the labs and the cath lab, ICUs and everywhere. This is called a complete stroke center facility. So if you go there, and they'll identify that if you reached in 4.5 hour time, I'll repeat, the 4.5 hour time, if you reach within that time frame, they'll identify the person having an acute stroke who is vessel is blocked, which can be opened up by the two different forms. One is medicine, that's called a clot buster medicine, which can open up the vessels, or the mechanically by like somebody is doing angiography and open up the vessels. The similar way they open up the vessels, so the blood flow become normalized again and the person become normal. Now, this is very important thing, because if any person having a young age the stroke, their overall the output for this family as well as for the society become completely decreased if you don't treat timely fashion, because if they become paralyzed in this one. So please that if you have come across any person who is the weakness of the one side, who has sudden change of the voice and one side of the body become weak, identify the acute stroke, ship the persons in earliest time before 4.5 hours to the nearest hospital who can equip to treat this stroke patients. The next one which we talk about an acute MI. Acute MI is called a cardiac cause, which is in a common language called a heart attack. Now everybody knows about heart attack. I don't want to talk much about a heart attack because it is very dangerous, because person can lose a life. So that's why people knows much better than any other disease. Perhaps despite of the awareness, there are several patients, several people who are still not able to identify that what to do in this one. Now, if somebody has a heart attack, how to identify? The person having chest pain, right? The pain is generally having the left side, but not necessarily. There are people who have pain in the neck, the pain in the jaw, which goes in the arm, which sometimes goes on the back side. Having a difficulty in breathing, having a perspirations, vomiting. These are the common symptoms which you can identify. But there are peculiar patients like in old age, the female diabetic patients who do not have typical chest pain, but they have probably just perspirations, or they have just difficulty in breathing. You can think over that could have a heart attack. Other possibility that somebody has a pain in the upper part of the abdomen, right? And these are the category of patients can have a heart attack. So if somebody has unusual pain, then the acidity, please always check the doctors. Go to the nearest hospital, check yourself, get one ECG, look after by the doctor's team. They can safely tell you whether you have a heart attack or not. And I request every one of you that please do not use any medicine by yourself. There are patients who has been prescribed, who is already treated by some of the doctors, and they can prescribe that you can take the medicine if you have such a symptoms. That will be okay. But if I'm prescribed some of the medicine and some other person has any problems, I cannot give this similar kind of understanding, the similar kind of problem, and give the medicine on the ground of that it helps to that person also. And specifically for this, people are giving sublingual nitrate or the Disprin tablet. It's not good because somebody has an ulcer in this ones in the stomach that can bleed more. So I request everyone that identify the symptoms of heart attack, go to the nearest hospital, seen by the doctors, get ECG and everything to be done, and once they'll confirm whatever it is, that will be more helpful for them. If somebody having these symptoms along with other symptoms like vomiting persistent over there, so rather than treating themselves, giving an antacid and giving the tablet to control the vomiting, better to go to this hospital. Now we received one more things that in a question related to how to identify hypoglycemia, which I told earlier, that somebody starts sweating, right? Somebody's if you say there's breathing become faster over there, they feel their heartbeat become faster. These are the signs that can have your sugar level goes down. You feel little blackout, or you feel little giddiness over there, that you can think that person's sugar might be go down, and you can offer them some sweet in the form. If person is conscious, then you can offer about liquid or the solid, some sweet. If he's semi-conscious or unconscious, you can give a sugar powder and go to the nearest hospital as soon as possible. Now we have the one more that if child having a choking, very interesting thing. This was I did not purposefully cover in this talk because choking is such an emergency that can be handled only that you have been trained for something. But I can still just give you the information that anybody who is sudden onset of difficulty in breathing, who is having a problem in speaking, problem in not able to speak sentence, it means his air pipe is blocked by something, which is somebody is eating, specifically the children who are just place something in the mouth and suddenly they choke and the air pipe. Now what to do? There are two different things. One for the very small child, that's called less than 1 year of age, and the people more than that, we suggest them do this called Heimlich maneuver, where you need to put in your tummy and then give an abdominal thrust forcefully that you can. But for that you need to be trained enough to do this one, because that's not should harm the person, and there are occasions that people do not identify correctly and do something wrong. But of course it is very important emergency, that's called choking, and if you identify timely and you intervene, you can definitely save the life in that. One more, that person having a low BP, which can cause, and what you can do. Now when you see some person, it might be heart attack, it might be this stroke, it might be person become unconscious, and you think this person become having a low BP, so which you can identify by that their pulse become faster, their the hands and the feet become cold, they are sweating, they're breathing a little faster. You can think that you can possible that they have they become look pale even, right? They are looking very pale in that time. You should do this, raise both the leg and side, right, both the feet up, and ask the person to lie down on flat, so that improve this blood circulation toward the heart, and probably you can improve the BP and ship to this nearest hospital as soon as possible. There's one more, is what precaution you need to take care while transferring a stroke patients. I can say stroke patients or any patient per se for the medical emergency. As far as possible, we always recommend that people should use an ambulance services, because when you're transferring an ambulance, any things happens in the middle of the way, the paramedic who is there in the ambulance who can take care of that. They can give support in the form of oxygen or start a IV line, give whatever the requirement treatment. So that is always helpful. And if person is conscious, they can lie down flat. But if person is become unconscious or semi-conscious, always try in a medical emergency patient. I'm not talking about this trauma patient, accident patient. I'm talking about normal medical patient, to be done on either side, right or left, and transfer, which I said earlier, which can prevent vomiting, which can goes in this air pipe if the person vomit, and the airway, the windpipe become open up, so the oxygenation's level will be maintained in the body. One of the important question comes in the golden period for stroke patients. Is the golden period is, I said earlier, the same 4.5 hours. 4.5 hours is in a time frame where you need to go to the stroke center. I repeat again, the stroke center, which is equipped to identify the stroke, which have a neurologist available who has a CT scan, MRI, lab facility, ICU facility, and the cath lab facility available, who can treat perfectly to this acute stroke patients. One more question is very interesting, which I always believe this is very good questions by this people who understand about how to differentiate somebody acidity problems or somebody's a heart attack. Now, person who used to have acidity problems very routinely, they are aware that what kind of pain, what kind of symptoms they are getting. Now, person who has a pain in the lower part of this chest or upper part of the abdomen, called acidity kind, which is little different than your when you have a heart attack pain or heart attack symptoms of that. So practically speaking, you cannot say that okay, that everybody who has a pain in the upper part of this one has an acidity, or you can 100% say it's a heart problem. It's not like that. But person who is experienced earlier about acidity problem, they can easily say that it's not look like acidity problem, it is little change or it is completely different in that. So that definitely trigger you. But I always suggest that somebody has a family history, like in the family somebody has a heart attack or undergone some angiography, angioplasty or bypass, somebody is diabetic, he is a high BP problems, he is a smoker, alcoholic, obesity, risk factor along with this one, and these are the symptoms, definitely go to this hospital and checked by the doctors. That makes a little sense in that. Now another question is can we handle the pediatric emergency patients if somebody has a fits or an epilepsy? Of course, yes. Emergency physicians, emergency doctors who works at Zydus Hospital, they are able to treat all kind of emergencies, any age group from neonate, child age, older age, young adults, everybody, any kind of emergencies. It might be the trauma, it might be the medical emergencies, every kind of emergency they can handle. And on the top of that, we have pediatricians availability along with a pediatric neurologist and the pediatric critical care who also have a backup to take care further in that. So that is real help to handle any kind of pediatric emergency at Zydus Hospital. I hope that it is helpful for every one of you. And thank you so much for your viewing this particular Facebook Live to handle medical emergencies. And if you help somebody, definitely it helps to the society, it helps to the nations, and then save more lives. That is the most important purpose which is initiated by the Zydus emergency team. And I wish everybody has a very healthy and happy life ahead. Thank you all.